All right, well today we're going to talk about parasites, and it's kind of a topic, it's very interesting. Well, we got to find out what a parasite is, I guess, so we'll talk about that first. So parasite has a host, and parasite basically lives at the expense of the host. You have your commensals, where you have two commensals in there was the doesn't benefit, doesn't harm. You have your mutuals, where two organisms are living together and they're both getting a benefit. So you have some of those. I'm not sure what those like the air ferns and stuff. I don't think they're really killing the trees that they live on, the oak trees. That's down in the south, but whatever. So we're talking about organisms though, and so you don't really hear a lot about parasites. Western medicine, they don't really talk about parasites too much, and it's because, well, A, they don't get trained in it, and B, you can't find what you don't look for, or you don't look for properly, and that's pretty much the case that we have here. So it's kind of considered a tropical problem. It's a third world problem. We don't have it here in these civilized countries, and that's, as we know now, everything's connected. It's a global village and all that. There's so many people traveling and bringing things from other continents. There's really parasites everywhere, and really parasites are an epidemic. What I see in patients, if you look at the list of symptoms, you're going to see that you have a few. But anyway, the major classes, you have the little ones. There's the nematodes, there's the amoeba and the the protozoa. And Joe talked about Giardia. I just moved. I lived in Giardia. Yeah, I lived in Giardiaville. I lived in Evansburg for 24 years. They had Giardia. I had a reverse osmosis water filtration system, and it was packed with Giardia. So there was Giardia in the drinking water, in the treated drinking water of Evansburg. It's very common. And sometimes you'll get diarrhea, you'll get constipation from it. But after a while, you get used to it, and you don't really have any overt symptoms. So it's kind of a lot of these parasites, they're stealth problems. You don't know they're there. And so the little ones, malaria, that's intracellular. It's inside the cell. That's a parasite. And so some of the other ones are kind of common. Let's see. Yeah, toxoplasma, that's the one from the litter box. You're familiar with that one. That one you can breathe in. So we're going to talk about how you can get them too. But you're cleaning the litter box. That's why expectant mothers don't clean the litter box, because, hey, you're sifting that down, the dust comes up in the air, you breathe it in, you're going to get it, And so it'll hatch later in you. Then you have your cestodes and your nematodes. Nematodes, those are your roundworms. There's a couple, it depends on the mouth. Some of them are hookworms. They attach to the inside of your intestines or your lungs, and they suck blood from there. What do we have? The threadworms. There's a bunch of different types. Oh yeah, they do talk about the ones they can show the picture. Elephantiasis, you have the leg that looks like an elephant. It's from a filaria. That's a small roundworm, microscopic roundworm, and that one will clog up your lymphatic drainage. Your legs won't drain, basically. The fluid goes down and it doesn't come back, so it stays down there. So that's one that you will see in the textbooks and stuff, but you don't. I've seen a few people with that actually, but you don't see it much. And so, what else do we have here? You have nematodes. Yeah, there's the roundworms, hookworms, threadworms, and then you got the flatworms. And the flatworms, some of them, the flatworms that have segments, those are the tapeworms, and the flatworms that don't have segments, they look like little leaves. Those are called flukes. So there's blood flukes, there's liver flukes. Flukes do a lot of damage. And so flukes, liver flukes, pancreatic flukes, lung flukes, and those I see in my practice. And they cause problems. And so you want to find out how you have, whether you have parasites. And so the standard parasite, the standard stool samples, you take your stool sample and you collect it and you send it off in the lab, and it sits around for a few days, and they'll look at it. It takes a little bit of transit time. And what Dr. Dietrich Klinghardt said, Dr. Ella, Dr. McElwee and I went out to St. Louis 2 months ago, 6 weeks ago, whatever it was, at the end of September, beginning of October. And what we found out from Dietrich Klinghardt, He's the famous German doctor who's been out in Seattle for 35, 40 years. He's like the Dr. Ella of natural. Well, he's a medical doctor and a PhD. So he's very learned, very knowledgeable about the very toughest cases. And he said, you know, the parasites, they secrete an enzyme within 15 minutes of them being outside the body. They know their environment has changed, and these enzymes actually dissolve the worm and they dissolve the DNA. So there's really no evidence. It's kind of like those of us old enough to know Mission Impossible back in the day. You know, the tape gets all sizzly and it destroys, you know, before, after he gets his instructions, you know. That's kind of what the parasite does, unless it's promptly evaluated. So for the eggs or for the parasites themselves. And so the miss rate is 92%, the find rate is about 8%. And so no wonder people don't think, doctors don't think you have parasites. Oh, see, we did the test and we didn't find anything. But they're there, you're just not finding them. So looking at the signs and symptoms, as you look at those, you have skin disorders, you have acne, itching, especially like the orifices. You have all kinds of unexplained illnesses, fatigue. The fatigues that don't show up, like when they do the tests that Dr. Joe was talking about, if it's unexplained, you want to consider parasites as a possible problem. What else? Headaches, depression, sleep disorders, including bruxism is grinding your teeth at night and slobbering on the pillow a lot. These are parasite problems. Of course, you're a little bit twitchy, nervousness, depression. Those are also parasite problems. And so you have a lot of things. Here's one that Ella told me, and that was hangnails. And hangnails, some people have hangnails with the nail splinters, and sometimes you have hangnails and the area around the nail is just totally shredded. Well, when you see something like that, you know that there's a problem. And what you'll see, there's a cyclical aspect of it. And parasites tend to get worse at the new moon, at the full moon, and as the full moon approaches. And so we'll touch back on that later, the timing aspect of it, whenever you're treating parasites in order to clear them out. Food sensitivities too, yeah. So those, yeah, food's a key thing because, you know, a lot of parasites are in the gut. A lot of times they can penetrate the gut wall, they can penetrate the bladder wall, however you get it. You can get parasites through walking around barefoot. There's some that will penetrate the soles of your feet. You can get it from swimming in fresh water. Some of these ones, you can get it from that. I think Chagas, sleeping sickness, I think that's one you get from swimming, like in swimming holes and stuff like that. That's more of a African and Asian type thing. South American, okay, thank you. So that's more of a tropical thing. Okay, so what else we got? So we also saw Dr. Simon Yu out there in St. Louis, and Dr. Yu was a Army doctor for 25 years, and he got his training. He cut his teeth down in Bolivia, and so they had a very limited, what do they call those? It was like a MASH type tent. You know, they got the setup for the locals, and they didn't have a lot of supplies, but they had some very, very cheap parasite remedies, and what he saw was all kinds of things got better. You know, so there's a little list there on your thing: asthma, psoriasis, MS, colitis, irritable bowel, vision loss, hypertension. All these things, you think they have nothing to do with parasites, and turns out that these people went on anti-parasitic pharmaceuticals, and they got better. And so it kind of proves itself. If that's the cure, it gets better. And some people with cancer get on antiparasitics, and they do better as well, is what we found. So he titled his book Accidental Cure because he got all these things better. He wasn't even trying. He was just trying to help these people out. And so Dr. Yu did a form of analysis called Meridian Stress Assessment, or EAV, electroacupuncture, according to Voll. Reinhold Voll was a German doctor, brilliant doctor, and I think it was back in about the 40s, I'm pretty sure. So he was evaluating how the electrical currents, the meridians in the body that the Chinese have talked about for thousands of years, there's a slight change, there's a slight conductivity change in these channels. The energy does flow along these channels. And so what you can do is you can measure how well that flow is moving or not moving, and if there's an imbalance, then you can evaluate what will balance it. And so what he does, there's a plate, he'll have a plate there, and so you have a points that are balanced, and then you get one that's not balanced, and he'll put something on the plate, and he'll test the point again, and if that doesn't do anything, he takes that one off there, and he puts this one on there, and if this one's an anti-parasitic remedy, and it brings it from out of balance, if it's a 25 and it should be a 50, and he puts that on there, he completes the circuit with that in there, that tells you that that's going to help. And so he didn't have to worry about stool samples. He's doing an energetic frequency assessment while the patient's alive and the parasite's alive. You don't have to study the carcass. Okay, so yeah, you're studying the frequency signatures of things, and that will get you the results that you want. It'll get you the evidence that you want. And so basically, when you have something that's alive, you have movement. And when you have movement, what you want to have is you want to have the ability to repeat the movement. You want to have, Joe as a cardiologist knows that, that's what he looks for. You look for the heartbeat for the cardiogram, and you see if it's repeated consistently or if there's aberrations in it. So basically, something that's healthy wants to be able to, if you're flapping your wings, you want to do it evenly. You want to be able to repeat, so you have an oscillation or a frequency. And so that's one of the signs of health. And what happens is when our systems are totally compromised by, or not totally compromised by any compromise, it can be partial or total or whatever, whenever they're distorted by having parasites in the body, wherever we're talking about, what it does, it results in a decrease in function, because that ideal frequency, that ideal speed that you're repeating the motion, whether it's a wing beat on a bird, whether it's a pump of the heart, there's an ideal frequency that occurs on. And when you have something else in there, you get the effect of like having all the clothes on one side of the spin cycle in the washer, and it's just going boom, 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 like that. And it distorts your oscillation, it distorts your frequencies. And when you have that distortion, your function goes down. And so you'll see on one of the symptoms things in there, you have what? You have seizures. Some of these ones, they go to the brain. So Lyme disease goes to the brain. Dr. Klinghardt said Lyme disease goes to the brain in these little nematodes. And so microscopic roundworms can penetrate the blood-brain barrier, and that's how the Lyme gets up there. Now Lyme is a corkscrew, Lyme's a spirochete, and the other spirochete that we know of is what? Syphilis. And syphilis, we know from Mozart and Beethoven, some of those old musicians, they had syphilis. Tertiary syphilis destroys your brain, and one of those guys at least was deaf for the last 10 or 20 years. It was still writing symphonies. And Beethoven, yeah. And so, but they had syphilis, and Lyme goes to the brain too. And another thing on a blood test, a lot of these things that we learned were just astonishing to me. He said a lot of times they miss it in the blood test though, and they miss it because why? It's because it's a corkscrew and it burrows into the tissue, so it goes into the connective tissue. It's in the mesenchyme, and it can burrow. A lot of times you'll find it in the kidneys and in the bladder. The bladder has the inner layer, and I think it's like a blood vessel. It's like the intimal layer, is that right? Is that the right term, intimal layer? It's like a muscular layer between like the surface layer, and they can burrow into there. So the urinary tract they like, and they like the brain. And they also like this area in your neck, your lymph nodes. So they're in your head, and they fill up these lymph nodes. And these lymph nodes, you have a chain of lymph nodes in front of this muscle, and you have a chain behind this muscle, and that's what drains your head. And so if these are all clogged up, your drainage gets poor. And so you'll have lack of drainage out of your head, and when this is all plugged up there, then it sets you up for sinus problems and cavitations. And so I've had Lyme for 9 years, and when I got it out of my knee, I had that excruciating pain. I thought, oh, it's dormant, or I killed it off or something. And so I found that wasn't really so this year Well, a couple years ago, I had a bunch of gum line cavities, and I didn't know what that came from. But if you're not getting draining out of your head because your neck's all clogged up, then everything up here is getting bathed in a bunch of garbage. And so I had all these gum line cavities. Well, this year, I've lost 3 teeth this year, and I started getting headaches again. I've had a problem with them for years, and I probably had 100, 150 headaches this year. And the upshot of that was I have a cavitation in my jaw, so the jaw actually gets infection in there. So anyway, you want to get the drainage out of your head, and the Lyme spirochetes can go up there in the parasites. And so the protocol that Dr. Klinghardt recommends is getting your big germs out of there first, and then the next smaller ones and the next ones. So you're going to work on the parasites, and then you're going to work on the molds. And parasites can also have molds the same way. You go on an anti-mold program, you're doing great, you get off of it, and then suddenly they start coming out of the parasites, and you get reseeded again. And so you're dealing with a mold issue again. So you want to do it in the right order, and you do that by getting balanced first. Again, to recap that, you balance your terrain, and then you have to do repeated cycles. It's kind of like the shampoo that says lather, rinse, repeat. And of course you never do that, but with the parasite cycle you probably would want to. But with the preparation, you get Dr. Yu's favorite quotes from Sun Tzu. You get victory with battle, and you get the best results with the least amount of effort expended. And you get that when you do it the right way. So you prepare for it, and look at the list on there and see how many of those you have. I'd be surprised if most of us don't have at least a few of them. I know, I noticed the hangnail thing on myself. You have to be willing to say, oh, well, yeah, maybe I do have hangnails, and they, oh yeah, the full moon's coming up. And then you don't have them for a while, and it's pretty interesting. But what you see is your health levels can go up dramatically. You can get your energy. Oh, I went 3 minutes over, I'm sorry. Wow, that went past. Okay, well, I'll wrap that up. Thank you for having me, and I guess if anybody wants to stay later, I'll be glad to answer some questions.